Hi, my name is Dr. Brittany Rush. I'm a chiropractor here at the Spinal and Sports Care Clinic. And today we're going to be talking a little bit about chiropractic and pediatric care and why somebody so young might need chiropractic. So the definition of a pediatric patient is just an age range between birth and either 21 or 18 years old, depending on your definition. So because that's such a large age range, today we're going to be talking more about the lesser half of that age range. So why would a baby need chiropractic care? If you think about the birthing process and how traumatic that is to a baby's body, then you kind of start to get a good idea about, gosh, maybe we should get your baby checked. And the babies, as they go through the birth canal, they're getting pushed and squeezed and pulled, and as they come out, they might have some places in their spine that are misaligned. And when there's a misalignment with the vertebrae in your spine, that pinches on a nerve as it comes out of your spinal cord, and that nerve feeds the muscles in the area, but it also goes to the organs. So as your baby's growing and developing, if that nerve is pinched, it can cause some issues down the road. So as your baby starts to grow and develop and reach their developmental milestones, they're also putting a lot of stress on their spine. If you think about when a baby's born, their spine is actually in a C shape, and they have to develop their own S-shaped curve that the normal adult spine is like. So when they start to bring their head up to look up, they're actually developing a new curve in their spine. So if you think about how much stress that puts on your baby's spine, it's a good idea to get it checked to make sure that they don't lead to problems later on in life. There's studies that are coming out right now that are showing if a child has pain in their spine, their back, or their neck at a young age, that correlates to pain as an adult in their back and their neck. So it's good to get them checked and make sure that everything is going well while they're growing and developing. So they start to pick their head up, they need to get checked. When they start to roll over from back to stomach, they start to twist their spine, which also puts a lot of stress there. So it's a good time to get them checked. If you think about when they start to walk, they're falling down on their bottoms all the time. So that's repetitive stress that they're putting on their spine and their bottoms. It could start to jam some things. So another good time to get them checked. When they start to become school-age children, they're being a lot more active. They can be falling at the playground. They can be playing really rough with their siblings or their family and their friends. Another great time to get them checked. The hard thing about young children and babies is they have a hard time to tell us when they hurt or when something is wrong, so we have to look for other cues, such as digestive issues, or they're really fussy, they have a hard time sleeping. These are all another good time to get your child checked when something's not quite right, and that could be issues in the spine that are causing those issues. When children kind of get older, like adolescents and teenagers, that's another great time to get their spine checked and to get treated under chiropractic care, because they're starting to have more emotional stress, which leads to spinal stress. As adults, we know that when we get stressed out, our shoulders start to go up, and that leads to a lot of stress in your neck and shoulders, which can lead to pain and headaches. We also start to see our kids using the bad posture with their telephones and their tablets, where that can create a lot of issues, especially later on as they start to grow and develop more. A lot of gamers, they start to have really bad posture too for hours if they're on their game for too long. So while they're under care, we adjust their spine and check their spine and their muscles, but we also teach them how to sit properly, how to hold their phone up so they're not hunched over, some proper gaming seated postures so that they don't keep creating stress and pain that can develop as they get older. So treatment for adolescents and teenagers looks very similar to how we treat adults, because they're a little bit older, their spines are a little bit more mature, but we always tailor our treatment to what the patient needs, their age, their development stage, and of course their comfort level and the parents' comfort level. It's all different depending on who walks in our office. The younger children and the babies usually use very low force treatment. It's very comfortable and very gentle, and it's different depending on who walks in the office. So if you have any more questions about pediatrics and chiropractic care, please give us a call. We can tell you what we can do for your child, and we can get you set up with an appointment to get them checked out.